Hey everybody, it's Matt Shu from Upright Health. In today's video, we're going to be talking about knee pain from arthritis. I had somebody fly over to California from the East Coast. Her name is Miyako. Hey Miyako, good to see you again. And she's in her 50s and she started getting some pretty severe knee pain. So she went to her doctor and said, I've got pain in my right knee. It's stopping me from doing stuff I enjoy doing. And the doctor said, well, you're in your 50s, you've got arthritis, so that's probably just going to get worse from here on out. Now, it's really interesting because she didn't really like that as an answer, and so she actually figured out that if she did a stretch for her lateral hamstrings, her knee pain actually ended up going completely away. So it was actually severe knee pain that was debilitating that she was told was arthritis, and just by doing a lot of stretching for her lateral hamstring, she noticed that her knee pain went completely away. So first, let's show you that stretch, and then we're going to talk about some research that's really interesting around knee pain and arthritis. Now, this is a stretch that I have shown in other videos before, but it's really important that you see it because apparently it can be really, really helpful. I'm not claiming that it's going to solve everybody's knee pain, but it is something that pretty much anybody can try to see if they can get the muscles around the knee to feel a little bit better and allow the knee to move in a more smooth, pain-free way, which is everybody's goal. So what you're going to do is you can just have like a couch or box or anything right next to you here, and you're going to just stick your foot out in front of you, okay? So as you can see, I'm not doing anything special. I just got my legs straight out here. I'm going to show you from this direction as well. I'm just sticking the leg out like that. Now, once you're in that position, you may already get a stretch. Some of you are going to feel it. In fact, today I actually feel a bit of a stretch going down my lateral hamstring already, probably because I have been exercising a bunch and then sitting a bunch and not stretching out my hamstrings. So if you feel a stretch in this position, that's fantastic. Now, what you can do is then rotate more to the side. So if it's my right leg forward, I'm going to twist my body more to the right, trying to bring the right hip back more to get some stretch going down along the outside slash back of the leg. Okay? You can play with foot positions. So if you point your toes a little bit more, you're going to get a little bit of a different sensation. If you pull your toes back, you're probably going to get a very different sensation. Depending on what you need, generally what I find is having the toes pulled back will get people more closer to the knee. They'll get a lot more of the tightness down here, and pointing it will tend to aim it up a little bit higher. If you feel like it's just a whole bunch of calf stretch, then you're going to want to keep the toes pointed forward. Also, another thing you can do is just try bending the knee ever so slightly to take stretch out of the calf and keep it up into the hamstrings. So that's how you're going to get into the hamstrings that way. You can also just stay pointing forward and lean forward. That's going to be less of the lateral hamstring, but you will still feel hamstrings most likely. For Miyako, the thing that she mentioned helped a lot was actually doing it with the twist. So if you want to be like her, then you can try it this way. Okay, so that's the lateral hamstrings stretch, just the kneeling hamstring stretch. Super easy and very, very effective. Now, for some of you, you may need to actually use something called contract relax, which is actually using the hamstrings, you're kind of pushing your heel down into the floor and then relaxing it. So you're using these muscles to generate a downward force. So I'm just going to, for illustration, I'm going to show you it's like going down like that. You're using the hamstrings to push, and then when you relax, then you're going to let yourself come forward again. Okay, so that's a really helpful stretch for getting into the hammies that way. There are other variations which you can see on our channel, but that's the basics of what Miyako was doing. If you want to do that stretch yourself, hold it for 1 to 2 minutes. Don't try to get away with that 10-second stuff. It doesn't really do anything. Go for about 1 minute, 2 minutes. Just go within your tolerance level. If it feels too intense, of course, cut the time short a little bit. But I promise you, taking your time to breathe and learn how to relax the muscles is definitely going to pay off. So now I'm going to do the other side since I don't want to be super lopsided, so I'm just going to sit here while I tell you about the study that was really interesting that deals with osteoarthritis of the knee. So this is a really fascinating study. I'm going to link in the description section. Basically what they did was they looked at 6,880 people, and they looked at x-rays of their knees, and they looked at their medical histories, and they looked to see whether or not they could see some relationship between evidence in their x-rays of osteoarthritis and actual symptoms and the diagnoses that their medical doctors had given them. So what they found was in this group of 6,800 people, they found 319 people had stage 2 to 4 arthritis. So basically they could tell they had like bone spurs, joint space narrowing. Some of them in stage 4 would be like bone-on-bone contact. Bad, ugly, horrible stuff in their x-rays. So only 319 people in this group of 6,800 actually had stage 2 to 4 osteoarthritis. 1,004 people had knee pain, which is really, really interesting, right? So you'd think, okay, well, maybe there should be some correlation then between those people with knee pain and having stage 2 to 4 osteoarthritis, right? Well, what was really interesting was only 15% of the 1,000 people who had knee pain had osteoarthritis in their x-rays, okay, in stages 2 to 4, okay? Now, what's even more interesting is that despite that, 59% of those people were given a diagnosis of osteoarthritis. So in the x-rays, there was no sign of arthritis for most of these people, right? Only 15% of these people had signs of arthritis in their x-rays. But because they had knee pain, they had actually been given the diagnosis of osteoarthritis by their doctors. So in total, in all 6,880 people, in fact, 1,762 of them were diagnosed with osteoarthritis. And that's interesting because of those people, only 11% of them actually had signs of osteoarthritis in their knees. And only 34% of the people who were given the diagnosis of osteoarthritis in the knee actually even had pain. So what does all this mean? I'm choking because it's kind of mind-boggling. But when you look at this situation, what you're seeing is there's no relationship in this large group. There's no relationship between having the arthritis and having the knee pain. And there's also not really a relationship between getting the medical diagnosis of arthritis and pain or x-rays or anything else. It sort of seems a bit random, or if it's not random, it's skewed in ways that really should make you, at least think twice about what it means to be told your pain is coming from arthritis. Studies like this show that there is quite a bit of ambiguity around our understanding of joint pain and arthritis. But what we know there is no ambiguity around is that the way your muscles can move, the way they control the joint, greatly affect your comfort and confidence in daily life. If you can retrain muscles around your joints to move things properly, you are definitely going to feel better. It's just a question of whether or not you figure out which exercises work well for you in your unique situation. So hopefully this study and this video give you a bit of a different perspective, give you a little bit of hope, and give you some motivation to start experimenting with your body as you take control of your own health. I want to take a moment also to thank David Silva and Albert Zaragoza, both of whom pledged $5 per month on Patreon to help us here at Upright Health make videos for you. So David, Albert, thank you very, very much for your pledge. And if you would like to make a pledge, you can go to the link to our Patreon page, which you'll find in the description section below. Don't forget to like this video, share this video, and subscribe to our channel. And also check us out on Facebook. You can find that link also in the description section down below. And as always, I hope you remember that pain sucks. Life shouldn't.